And this morning we have a conversation with, I hesitate to call you the new dermatologist because you've been there a while at IRMC at Chestnut Ridge. She is Dr. Therese Wilson, and she's in dermatology at the Indiana Regional Medical Center. You having to fight that over there?
No, I didn't know is this how close I should be?
You're good. You're absolutely perfect
great.
Right where you are. And so that's our way of introducing you to the community, but you've been there for, 4 weeks now?
This is week 4, and I hope to stay there a long time.
Oh, that's good. That's good. So tell us about yourself. You've been in the practice of dermatology for a rather lengthy time?
25 years.
That's rather lengthy.
Yeah. But one thing I'd like to let people know is I'm really a down-to-earth, plain-speaking dermatologist. I like to be upbeat because there's so much to be stressed about that if I can help you with your dermatology problems, come on in.
All right.
It makes me happy.
Well, that sounds like a good plan. And that's something, it doesn't matter what region you're in. This region isn't, I guess, unique in the world of dermatology in terms of the problems that people have with their skin than any other region. But people really should be on a regular routine of dermatological visits, should they?
Yes. When you're younger, you probably don't have much problems other than acne, warts. But later on, really, skin cancers are so plentiful, particularly in areas that had farmers and lots of outdoor occupations. It's incredible. In fact, 1 in 5 Americans will have a skin cancer at some point in their life.
Wow.
Yeah.
Wow. And there are a variety of ways to treat them and depends on the types and everything. And obviously, you're the person to see to get to the bottom of it.
Sure. I can help with a variety of conditions. And the basic perception is that dermatologists just treat acne and warts. Well, we do an amazing variety. Psoriasis, eczema, moles, changing skin lesions, rashes, just even funny sensations on the skin. People come to us for that. And we are the hair, skin, and nail experts in dermatology.
Oh, really?
You would not believe, well, yes, you would. Women are very sensitive about their hair and losing it. Well, men too, but they don't usually want to say it.
Yeah, but with women, that becomes a really, really big issue.
Yes.
And so dermatology is an area that can help there?
There are some things you can do, but I'll save you a lot of money from telling you what's just not even worth your money or time.
Yeah.
There's a lot of misinformation out there about hair, and, well, I can't get into that now, but if you have that problem, we can help, we hope.
We are here in the middle of January, toward the end of January, so we're in the middle of winter. And people might think winter is the time when we're not getting outside as much, we're not out in the sun as much, and so we're not going to have as much exposure to sun and to sun damage. Is that really the case, though?
No. Well, summertime, yes, lots of intense sunlight, but there is reflection off of snow. In fact, one important skin study was done with sunscreens in skiers. A split-face study put SPF 85 on one side of the face and SPF 50 on the other. And every single skier and the raters of the study showed that the SPF 85 was better at preventing the problems from reflection of the sun off the snow.
Wow. Okay.
Who'd think about that?
So take us inside the science of SPF, because that's a very confusing thing.
Yes. SPF means sun protection factor, and it's actually only a UVB rating. It tells you nothing about UVA, and people don't know that. And it is a measured study with X number of ounces per body surface area that you should be applying. So if you're supposed to put one in the laboratory, after an SPF 30, there's only a minor percentage of improvement of sun protection. But in real life, we don't put on nearly as much as we are supposed to per the rating to get that number. Yeah. So if you put on an SPF 30, you spread it out too thin, you've probably got about an SPF 15 or less. So really, I tell people, forget the studies. The percentage isn't what's matters. You have to protect yourself some way, somehow. Get a broad spectrum sunscreen. That means UVA and UVB protection without a rating on the on the UVA side.
Mm-hmm.
Go higher. SPF 50 and above, please.
Okay. And apply it liberally. I think there's the idea, especially when you go to the beach. I put it on when I came out this morning. I'm good for the rest of the day.
Not really. You have to reapply it. And it's a pain. I don't really enjoy putting on sunscreens myself. So I cover up more. Hat, sunglasses, cover up more.
Yeah.
I actually wear long sleeves, white loose T-shirt for mowing the lawn.
Mm-hmm.
I'll be out there 3 hours mowing the lawn, covered up.
Me too.
Yeah,
I don't do the cover-up thing like I should. And there are people like me that do that. We know the risk factors. We get all the information. We still end up in your office, and you still end up with that liquid nitrogen. Because there are a variety of ways to treat skin cancers, precancers. Take me through that whole bit. Precancers, they use
Tom,
that term.
Are you trying to get a free visit out of this?
I am not. I am not, because it hurts. No, it doesn't.
Okay.
But take me through what they use that term precancers.
Precancer are early sun damage. The skin cells get damaged by the radiation. Mm-hmm. So the precancers are rough, scaly, red spots with flakiness. And a man might typically say, oh, I get these scabby things on my ears. I pick them off and they come back. Well, those are precancers. They can be anywhere: face, arms, trunk, legs, anywhere. Mm-hmm. But they're going to be in the most sun-exposed areas. For most people, it's going to be their nose or their ears and short-haired people. And it's very common. So we freeze those with liquid nitrogen. If you have more extensive precancers, then we can use creams, which are, you have to use them for about 3 weeks. They turn you really red. They're not fun. And then there are some newer modalities. There's actually a blue light that you can put people under for an intense blue light for a number of minutes after we put on a photosensitizing substance, and that kind of zaps you all at once. So multiple ways to treat those.
A lot of ways. You mentioned moles before, and everybody has them, and they hear about irregularly shaped moles, but it's not something that we pay as much attention to as we should, is it?
Well, when I trained in dermatology, there wasn't that much emphasis on moles. Now it is mole mania, and so we call it the Mole Patrol. And we do full-body skin examinations. I tell you what to look for, but I don't ask you to judge the lesion. There are many common benign lesions that people think are moles that are not moles. So those are more prevalent, those funky-looking warty moles that are called keratoses, are more common after age 40. And that's usually what brings the 40 and up population into the office. Mm-hmm. So, yes, we look at all of those. I have a special instrument called a dermatoscope, and it is so essential when you're looking at a mole. It can save you from a biopsy. It doesn't replace a biopsy, but special tools.
All right. There are a number of different treatments that you can have for skin cancers or for skin conditions, and we think about dermatological peels and things of those nature that we hear about. Is there new things, or are there new things coming in the field of dermatological treatment? Yes.
Lasers are becoming more and more sophisticated. Now they do have lasers to treat. We like to start early. We can do a lot of preventive things. We have lasers that are for sunspots, for blood vessels on the face. Mm-hmm. There are freshening, you mentioned peels. Peels are still very important. They have went out of favor, and now they've come back into favor. So there are a lot of things we can do to tweak things before things go bad, in the younger generation particularly. But as you get older, sometimes we don't always want surgery. Surgery's a must if it's truly a skin cancer.
Yeah. Talking with Dr. Therese Wilson this morning, and we're talking dermatological practices. You are in practice at IRMC at Chestnut Ridge.
Correct. It's on Colony Boulevard, at the IRMC building, mm-hmm. and I'm very happy to be there.
And if somebody wants to make an appointment to come visit with you?
Okay, here's the number, 888-452-4762.
Mm-hmm. Say it again.
888-452-4762. Now, they can make appointments for you. If you had a question about, well, does she do this or does she do this procedure, does she do this, they would have to direct that call to our office so that we can ask for more specifics.
Yeah, but really to get established is a very important thing to begin those regular routine visits. Do you recommend annual? Or is it based upon the patient and what you see from that first consultation?
It is risk dependent.
Okay.
And what you have. But I have some people that come in for mole exams at age 16, and most 16-year-olds don't have suspicious anything. But it's not a bad idea, particularly if there was a family history of melanoma, then they do need a baseline exam. So we can always do that.
Yeah, okay. So it is a good idea to get yourself hooked in with Dr. Therese Wilson at IRMC at Chestnut Ridge, your dermatological visits. Anything we have not covered that you wanted to make sure people knew about when you were here this morning?
Well, I'm going to be adding some services in a few months. Right now I'm doing general dermatology, biopsies every day. We will be getting a wonderful laser, the AeroLace laser, for 35 FDA-approved indications. So it has medical conditions we can treat with it and cosmetic conditions.
Okay.
So lots of stuff. And I am particularly interested in some anti-aging ingredients. So we will have some better dermatology-grade products in the office. I'm not a salesperson. I'm a minimalist. I like some simple things. But hey, who doesn't want to tweak their skin a little bit when they're middle-aged? Or older.
Dr. Therese Wilson, it's been so good to meet you. And I'm betting folks have fun when they come to visit with you, too.
They do, and I do like people to know that, I grew up in Monroeville, Pennsylvania. I've been here, there, multiple states, roundabout route back here, but I am so happy to be here because Blairsville and Indiana have nice people, and that's what makes me tick. I like nice.
Beautiful, beautiful. Thanks so much for being with us today. We appreciate it.
Thank you so much.
It is the voice of Indiana County, WCCS 101.1 FM and AM 11 FM and AM 11.